Nursing education continues to evolve with changes in technology, medicine, law, and workforce expectations. And we know it's a vocation that's always in demand, especially in rural areas. Let's look at nursing education in Academe today. We're talking about Academe today, specifically degree programs in the field of nursing. I'm Jamie Liddy, Director of Broadcasting at UNC Pembroke. With me today to talk about this field and its evolving demands and expectations are Dr. Jennifer Twaddell, Chair of the Department of Nursing, and Dr. Cherry Beasley, the Belk Endowed Professor in Nursing. Thanks for joining me. Welcome to the TV studio, and welcome back to Dr. Beasley. You've been here many times before.
Several.
Great. Let's not confuse the audience. You are both registered nurses,
yes.
But I called you doctor because you both have the PhD in the field. And I think that's an evolving trend as well, at least the latter half of the 20th century, because before that, maybe the PhD was not the terminal degree in nursing. I think nursing programs first started in hospitals, right? And then they moved to universities increasingly, and the doctorate became standard. So what led you to get the PhD in nursing?
Actually, nursing education started in the academic environment in the 1920s. In the beginning of the 1950s, there were doctorate degrees in nurses, but they were only in urban sites. Most nurses in the South had degrees in doctorates and other degrees such as sociology. Then in the 1960s, there began a proliferation of PhDs in nursing. And so not in North Carolina until the late 1980s did we actually have doctorate degrees in nurses. So what caused me to want to do that? I have been an expert clinician and an educator for a number of years and actually did quite a bit of research. But the PhD was what prepared me to be a researcher where I could do a vast amount of research, number one, but also different types of research. I really particularly enjoy what's known as qualitative and quantitative research techniques, which gives me a completely different picture of the humans that I'm caring for in nursing. So those mixed methods, combining both of those in the same research study, was actually what I focused on a lot when I was in my PhD program.
Dr. Twaddell, what led you to go from the RN to the PhD?
Absolutely. Well, I had been a bedside nurse for about 10 years. And I decided that I wanted to move into education full-time. And so I started here at UNC Pembroke with my master's and subsequently started the PhD program a few years later. The PhD truly is, to me, the degree to get if you want to stay in academia for a long term. And so I had looked at other terminal degrees such as EDD, and the DNP wasn't really out yet at that time, but PhD really was, for me, the way to go. It's like Dr. Beasley said, you learn how to research, you learn how to better care for patients. You get the personal side as well.
What does one do with the doctorate in nursing besides becoming a college faculty member?
You can actually become a researcher. There's many opportunities to just be a full-time researcher in nursing. There are many other alternate or specialty pathways that accommodate that. Nursing informatics, for one, is becoming very large. Working in hospitals, especially those who are accredited or who are seeking magnet status, need PhDs on faculty. You need them to publish and to promote. And so they're really needed in a variety of settings.
And we don't offer the doctorate here, so how did you manage that, both of you?
Worked full-time and went to school.
Yes, absolutely.
From where is your doctorate?
Mine is a combined degree from UNC Chapel Hill in East Carolina, because I also wanted to major again in philosophy. And so I had to put together a PhD program, which is one of the great things about when you are maybe, as I would say, later in life going for my PhD. I knew some things I wanted to study, having already done some research. And so I went to East Carolina for part of it, and UNC Chapel Hill for the other part.
Dr. Twaddell, how did you get yours?
ECU and UNC Greensboro are truly the only programs that allow you to go what's considered part-time in the state. Other degree programs require you to go full-time, and so in order to work full-time and go to school, ECU and Greensboro were the programs. And UNC Greensboro, after interviewing, really did fit my needs best.
Great.
And can I just add one thing to what we were discussing before? Nursing is an evidence-based practice. So we're a practice degree and a practice profession, but it's based on evidence. And so in order to truly have the evidence that's needed in our field, so nursing is the study of human response. So how's the research going to be used to develop the evidence? And so I think that's one thing that intrigued both of us about moving towards a PhD, and why it's not just people who are in academe who use that. It's researchers all the way across who are looking at developing this evidence that we need to develop improved practice and therefore improve health outcomes.
Right, so even administrators of clinical services should probably get the doctorate.
In my doctoral cohort, I was the only person in academe. Everybody else was in practice.
Okay. Now let's talk about the degree programs that we offer at UNCP in particular. What do we have?
UNCP Department of Nursing started out as an RN to BSN completion program. Many years later, about 12 years later, we started the pre-licensure program so that a student could go they weren't a nurse when they started, into completing a baccalaureate degree. And we had those two programs for, another 10 years or so before we started the master's degree program. And we have 3 tracks that started in the fall of 2013. We have the nurse educator, the rural case manager, and the clinical nurse leader. They're all non-clinical degrees.
So the RN to Bachelor of Science in Nursing, the RN comes from the associate degree level?
Yes.
Okay. So
or a diploma.
Or a
Okay.
hospital.
Hospital diploma. Okay. So would you say that we typically get more students who are making that leap, or do we get more of the traditional freshman who knows they want to go straight for the Bachelor of Science in Nursing?
Our pre-licensure program is really a good mix. I'd say almost 50-50 of students who are coming in straight from their freshman year, the other half being those who are actually, this is their second degree or their second career. The RN to BSN track still continues to be solid, but it waxes and wanes, I think, to meet the demands of the community.
Tell us a little more about the master's degree program at UNCP. You know, what is the career path for that student? What are they looking for?
The master's degree in nursing truly is a specialty degree, and so students choose that track if they want to specialize. The pre-licensure program produces nurse generalists, and so they know a little bit about a lot of things and they're able to go into different fields, whereas the master's degree truly prepares you for a specialty degree. And so students who complete the master's can go into a wide variety of things. They can go into academia themselves and teach at the community college or pursuing into a university degree level. They can teach in staff development at a hospital. The clinical nurse leaders truly do lead units and look at macro systems and microsystems and look at how things are problematic and how to solve them on many different levels. And our rural case managers truly do look at the care of a patient, the whole patient, and they truly try to set the client up with community resources, and so it's very outpatient based and very community based.
Tell me about men in nursing. Is there still a stigma to men in nursing, or are we seeing increasing male enrollments?
I'd say about 10% of our enrollment is male. Is that an increase? It's actually a slight increase possibly, but it's steady.
It seems to hold here for a while.
So it's been that way for a while, neither increasing nor
Not
decreasing. And what do the male students say, or do we have male faculty? You know, do they feel like people look down on them for nursing as a female profession?
I don't think they do at all. We do have 2 male faculty. They're great role models. They do help our male students, but I have not heard any of our male students say anything negative about how they're treated on the floor. In fact, in a lot of places, they are highly revered for many things. Not only just moving patients, but the thought process is maybe a little differently, or just their creativity.
Personally, I just want a competent medical professional, and I don't mind what gender they are. So we hope that's what UNCP is producing as well. Now, I've read in various sources that we don't have a nursing shortage in North Carolina, but we do have pockets of shortages in the rural areas in particular. How do you see that shortage meshing with UNCP's historical mission as a regional comprehensive?
I think they are very synergistic in that, as you are correct, North Carolina as a whole at this time doesn't have a nursing shortage. However, all the rural areas in North Carolina has about 64 rural counties, and all of them are currently experiencing nurse shortages. And not only nurse shortages for RNs, but nurse shortages for areas of specialty, as we were speaking of rural case managers, educators. Programs that have need faculty are very short. Actually, that's true statewide. But if you look at UNCP's mission as a community serving outreach institution, we are here to develop a workforce that meets the need of our region. I think our program fits hand in hand with that. So when we first started our nursing program, even though it was an RN completion program, one of the reasons that we were able to begin was because we had the lowest educational level of nurses in the state. And so what our program has actually, we find, have increased that phenomenally. So that's not only true, and we find that a lot of our graduates from our RN to BSN program and our generic program actually are now faculty for other people. They're nurse educators, they're nurse administrators, they're nurse practitioners. And so we see them all the way through the different roles and positions that they have. And so that's a critical mission that we feel that we complete for the area.
Do they stay in the region, do you know?
I would say 90% of our students stay in the region. We do have a lot of people who are connected to the military, and so they move, but we look at that as being actually that's serving the nation. And even a lot of those we keep up with. I got a call the other day from a young man in South Korea saying, I don't know if you remember me, but so they are in the military and their military spouses, but even they come back and try to stay connected and really watch for that. The other thing that we do is we really focus a lot on the live laboratory that our community is, not only for research but for education. So we have a very diverse community, so we were the first nursing program in the state to require a course in transcultural nursing for all of its graduates. Because if you're going to care for people in this area, you need to understand the role of culture in healthcare delivery. Now we're looking at implementing mainstreaming or having the themes of rural. What's different about rural nursing versus urban nursing, where you have all the facilities at your touch point? Everybody's saying, oh, we'll just have them go into my chart and do that, where, as you know, half of our rural area doesn't have access to high-speed internet. They're not health or computer literacy to the point that they can do half of their stuff online. Right. So we really have to look at a different way of educating nurses so that they can meet the need of our community. So it's not only are we making a workforce that is a generalist, but also a workforce that meets the need of our region that we're committed to serving here at UNCP.
Well, let's talk about teaching, because you mentioned some courses in particular. And Dr. Beasley, you are our campus's 2017 Board of Governors award-winning faculty member for teaching, excellence in teaching. And that's an honor granted annually to one professor from each of the 17 campuses. And you're nominated by an awards committee, right? So they've gone through your portfolio, observed your teaching, there's letters of recommendation, they've looked at your student evaluations. So it's quite an honor to be a finalist, right? Let alone the winner. So congratulations on that.
Thank you very much.
What can you tell us about your teaching philosophy in general?
I look at teaching as one, not content driven, but student driven. A student comes into a classroom and they already bring some things to the classroom. So first of all, you have to understand where that student is and why are they there. So I may have a student who comes from Charlotte and a student who comes from Fairmont, and they bring some different things to the classroom. So I look at ways of integrating those student experiences into the corporate learning experience, but also looking at, I'm not looking at how much content can I give, but where am I looking at guiding the student for competencies? As you have said, you want a nurse who's competent. And so when I look at that, I look at, well, then how can I learn with you? So I try to create a learning environment in the classroom such that I'm learning and they're learning, and therefore I find that it's less pressure. I find that students are more free to ask questions. I look for real life experiences to bring into the classroom, regardless of what's happening. So like right now, we may be talking about, in a rural setting, what's going on with the Atlantic pipeline and what is the data to support the different sides, since I teach research. And so students then become engaged at a different level when you are focusing on them and helping them understand how to not only take the information you're giving them, but interpret it or integrate it into their practice and into their mode of thinking. So that, if I can teach you to think and teach you to research and continue to stay current, you're going to be a much better nurse 15 years from now. Because what I'm teaching in the classroom right now is going to be outdated in 3 years.
Mm-hmm. I can definitely relate to that in terms of technology in our field, constantly changing, and it's really about the fundamentals at some point rather than trying to keep up with the Joneses. Now, Dr. Beasley, I did have the privilege to observe your teaching one night, and you were actually subbing for someone else that night, and the students were presenting their research, presenting their findings, and you actually were able to do an excellent job of relating what they had learned to prereqs they'd had, relating it to co-requisites they were taking, and you did a good job making links to courses you knew they would be having. So I was incredibly impressed by your knowledge of the whole curriculum and what their experience would be, and the way you responded to all of their findings. I think they were researching nurse theorists.
They were looking at nurse theorists often direct our practice. And so your philosophy of nursing practice and how the different components of nursing work together are often driven by different theoretical frameworks. But I think one of the things you have to look at as a nursing faculty, or that I look at as a nursing faculty, is that it is you learn in context. So I need, as a faculty member, to know, like, what is my student bringing? And then how, through use of repetition, well, this is a thought you had in this previous class. So therefore, let's look at it now you may have had stats, for instance, in something else, but now let's look at it within the human science of nursing. How can we incorporate that? And then how can you take this building block and move it to your next learning experience? So it's cumulative, as nursing practice is. And so therefore, I think it impedes me as a nursing faculty to assure that I'm teaching that way. Because that, again, I'm role modeling thinking, which I obviously think is the most important parts.
Right. And what else should teaching be like in nursing education? Because I've noticed a lot of new technology in the Weinstein Health Sciences building. A few years ago, I know someone was experimenting with virtual worlds like Second Life. So what do you think teaching should be like in nursing education?
Well, it's like Dr. Beasley was saying, if we taught nursing students everything they needed to know before they entered nursing, it would take us about 7 years, and that's what the literature says. And then by the time they were actually licensed, their information would be out of date. So it's evolving so fast that we truly do have to be more concerned about teaching them how to think. It's not what you know, it's how you use it. It's making sure they understand the context in which they use it, to make sure that they know where their resources are, to make sure they understand how to ask the right questions to benefit the patient. So we are evolving at a very, very fast rate.
We also use, as you saw, a lot of simulation. Our classrooms, we use every means of communicating because you want to use this multi-sensory experience for students. But the wonderful thing about simulation is that students have an opportunity to practice where they are in a safe mode without doing any harm to a patient. And so then that allows you to tier their learning. And so I may start this day with one concept, and then I can add variants of contextualization onto it. And so they learn safely, but they learn in a way that will eventually produce them to be a solid nurse.
Well, we actually have a short video about one of the simulators, I guess you would call it. It's one of the kind of living mannequins, if you will. So let's take a look at that video.
I can't breathe.
Having trouble breathing is just one of the patient scenarios this high-tech mannequin can perform. Standing 6 foot 2 inches tall and weighing over 200 pounds, this human simulator is named Zagreus. He is a new simulator in the nursing department. He was donated by the State Healthcare Association and was named after UNC Board Governors Association President Craig Souza. UNCP's Clinical Learning Center Director, Melanie Moody, says the mannequin is very interactive and can assist professors in teaching real-life scenarios.
He's very interactive, so he has heart sounds, he has lung sounds. The students are able to take vital signs on him, and he also has access for IV lines as well as chest tubes. The instructors are able to allow the students to get a more hands-on approach, so the students are able to come in here and work with the mannequins in case they may not be able to get into the clinical setting. They're able to come into the lab and it's a more real-life situation, and the students are able to practice that way.
He can also have heart attacks, collapsed lungs, and a stroke, as well as interact with students through pre-recorded messages, or professors can use a microphone and talk to students to make it more realistic. Students interact with Zagreus in classes and labs, giving them a safer approach to experiencing real-life situations they will encounter. This gives the students room to learn from mistakes to avoid in their career. Senior nursing student Caitlin Kurtz says the new human simulator will be beneficial to her education.
Being able to use the new human simulator will allow me to increase my education and knowledge by experiencing things I would not be able to experience without the mannequin.
That is really interesting. The technology is incredible, and you don't risk harm to a real person, a real human. But let's talk about those real-life clinical situations. Who are your community partners for our students to get the hands-on with real humans?
We have several community partners. Obviously, we have inpatient settings, Southeastern Regional Medical Center. We go as far north as Cape Fear Valley Medical Center. We go to the west to First Health, and those are our inpatient experiences. We spend a lot of time in the community. Healthcare is truly moving to the community. We spend a lot of time in health departments in several of our neighboring counties. We spend a lot of time in long-term care facilities. We're starting to move a larger portion, or looking at moving up a larger portion of our clinical there. That's where our students start. We also, for the master's students, use community colleges. We use universities. We go to public schools. We've even been to the correctional facilities lately. So we go to any variety of locations where there are patients, and there are people in need pretty much anywhere.
Is it what the rest of us might think of as an internship, or do you call them student nurses, or how do they do it?
The students are student nurses, and they it's not really an internship. They have a certain number of clinical hours per course they need to complete. It's a minimum number. That's an average for how long it would take someone to finish those competencies. Some take a little less, some take a little more, but they all have to complete at least 90 hours. And those are supervised clinical hours for our pre-licensure students. We are with them in the settings of ratio of 1 faculty member to 10 students. And then that changes for RN to BSN because they already have a nursing license. And so their clinical opportunities or practicum experiences are a little less supervised and a little more structured to meet their individual needs as to their strengths and weaknesses. And I would say the same thing for the master's students. We have to have 1 faculty member for each 6 students in clinical for the master's program, but they are already licensed. And so we try to structure their experiences related to their career goals, to where their current learning has already taken place into their specialty track.
Do you have close cohorts of students who go to classes with each other basically the whole 4 years? You know, they get to know each other, or is it a very large nursing enrollment?
We accept students in the pre-licensure program only when they're juniors. So they may have known each other in their general education classes, but they really do form a very tight-knit cohort when they begin the nursing program. So it's so the learning can be cumulative and moving from simple to complex, from individual to community-based. We have a very structured curriculum so that they begin together and they have to move through in a pretty lockstep way of education. So they know once who you start that summer with, you tend to walk across the stage with, 23 months later. So does that. We find that RN to BSN students obviously are not as much cohort driven because they are in and out of the workforce, or in and out, the educational program, depending on what their workforce needs are. And that program is totally online. So again, talking about technology, we use a phenomenal amount of technology to deliver an online education program. Everything from virtual hospitals, virtual physical exams. And then in the master's program, again, those tend to be somewhat cohort driven, but because they have a lot of general core courses that they have to take before they start their specialty courses. But then we find once they start their specialty courses, they tend to stay in the same cohort and then become collaborative learners with their faculty.
And so I imagine you also get to know your students very well. I mean, you mentioned the guy who called you, and he's in Korea now, and he said, "Do you remember me?" I bet you, of course. You said, "Of course I remember you," right? I mean, it seems like it's a very hands-on, engaged pedagogy, so you're going to get to know your students really well.
Especially if we have them in the clinical setting.
Sure.
Because you interact with those students a minimal of 6-7 hours a week in a small group setting, and learn a lot about them as well as reading all their writings and stuff like that. So you learn students a lot in a variety of ways. We also interact with students a lot outside the classroom and structured learning environment. Not only with office hours, but just our building on Sunday afternoon. You would be surprised how many nursing students are in there studying as our cohort. So they will, if I walk in there to pick up something, it's like, "Hey, Dr. Beasley's in the building, can she come and answer some questions for us?" So we do a lot of that, or we are looking for that real live experience to take students to engage them in the learning process. So we may be working with something that's like breastfeeding in the community, and we have an opportunity to take them and design a breastfeeding workshop for the community. That's not necessarily just our clinical hours, but it's an opportunity to learn. So it is a very intense, hands-on opportunity.
That's great. I mean, UNC Pembroke seems so strong in nursing right now. I've watched it grow. I've been here 16 years.
So we've watched most of our growth, right?
Yes, absolutely. And we're just all really excited and proud about it. And they tell me we're about out of time, so I want to thank you for being here. You've been watching Academe Today, produced on campus at the University of North Carolina at Pembroke. Thanks again to Dr. Jennifer Twaddell and Dr. Cherry Beasley from the Department of Nursing. I hope you'll continue to tune in to explore issues and trends in higher education.